Hello, everybody. I welcome you all to the exclusive talk show on sexual health care, an initiative by Integrated Health and Wellbeing Council, powered by JB Chemicals and Pharmaceuticals. I am Dr. Asavri Sawant, Public Health Specialist at IHW Council, and in this live session, we will dive deep into the topic of latest advances in the treatment of impotency. Openly talking about sex or sexual problems is a great taboo in India, even at this day and age. Keeping doubts and queries about sexual health problems extremely private is one of the biggest root cause of various sexual health issues in the country. Male impotency and erectile dysfunction are the two most common problems amongst males. Studies conducted on India's sexual health problems indicate that a large number of Indian males suffer from impotency compared to other countries, making India the impotency capital of the world. It was observed that 1 out of every 10 Indian men is impotent, and nearly 25 out of every 100 men with erectile dysfunction are below the age of 30 years. Doctors suggest that creating a safe and healthy environment to talk freely about sexual health is one of the primary ways to aid the treatment. Hence, the aim of this talk show today is the same: to impart expert guidance. We have here with us Dr. Chirag Bhandari. Dr. Chirag is the director of Institute of Andrology and Sexual Health and has more than 8 years of experience as a professional sexology practitioner. He has treated many patients with andrology and sexual problems like premature ejaculation, male infertility, penile disorder, erectile dysfunction, hypogonadism, retrograde ejaculation, and other male reproductive health disorders. And he also has various laurels under his name. Dr. Chirag, we welcome you to the show.
Thank you very much, Asavri, and thank you, ISW, for giving me this opportunity to talk about male sexual health freely and openly with our audience. I am really delighted to share my knowledge and my experience of treating these kind of patients with your audience. So thank you once again for welcoming me.
Thank you so much, sir. So the topic for today is sexual advances in treatment of impotency. But let us start with the basics for public health awareness. So can you please throw light on what are the common sexual health issues? What impotency is? What is erectile dysfunction? And are these two same? Over to you.
Yes, so the most common sexual problem which we deal with in our practice is basically premature ejaculation, which means ejaculating too soon. That is the most common. But at the same time, the other most common problem is impotency or erectile dysfunction. Both impotency and erectile dysfunction are similar. Apart from impotency, premature ejaculation, we also deal with patients who have problems with reproduction, like those patients who have sperm problems, like the sperm count is low or it is zero, patients who have varicocele, or patients who have pain in the testes, patients who have lump in the testes or lump in the penis, patients with STDs, sexually transmitted diseases, prostatitis patients, pelvic pain syndrome patients. We have all these kind of different patients, but the most commonly I would say is erectile dysfunction and premature ejaculation. Now, the definition of erectile dysfunction according to the latest guidelines is basically inability to achieve an erection or sustain the erection satisfactory for sexual intercourse. So that is what is erectile dysfunction. If you're not able to get it up, or if you're not able to, if you're able to get it up, but it is not able to maintain, or it doesn't stay long, then that is called as erectile dysfunction.
Answer: impotency is erectile dysfunction in the long run.
Impotency and erectile dysfunction are quite similar. Erectile dysfunction is a scientific name. Impotency is a layman's term. Also, you can call a person who has a problem with sperm or zero sperms as impotent. uh, but you cannot tell him that he has erectile dysfunction. So mostly erectile dysfunction and impotency refer to the problem with the erection most of the times.
Okay, okay. Thank you so much for explaining that, sir. So, can you please throw some light on how common is impotency in India, or how common is impotency or erectile dysfunction, and why younger generation is going through sexual health issues?
So, impotency is very, very common in India because of many factors. Because primarily because of the lifestyle. It is estimated that there will be about 32 crore men suffering from ED by 2025. Almost 2 to 3 men out of 10, they have problems with erection. As the age increases, the prevalence of erectile dysfunction also increases. So suppose if the person is 45 years old, then there is a 40% chance that he will have erectile dysfunction. And with every decade, there is a 10% increase in the uh, prevalence of erectile dysfunction. So at the age of 50 or above 50, there will be 50% of the men would be impotent. So as the age increases, it also increases. But in the last few years, especially after the COVID, we have seen a spike in young men coming for treatment for erectile dysfunction. And that is because of all the stress and the tensions and the hectic lifestyle of this generation. And it is definitely going to increase as we progress more in technology, and as we become more hooked to our mobile phones, we become more sedentary, it will become more and more.
So, sir, can you please elaborate on the last point that you shared with us, that making, as we are more sedentary, it affects erectile function, and it also affects impotency. So, how are these two linked, and how can the younger generation protect themselves from not having these issues in future?
Well, so the most important thing is basically stress. So that is the biggest risk factor for the development of erectile dysfunction. So as you would have seen in the news, so many young men are dying because of heart attack. Like men in their late 30s. In fact, recently, yesterday only, there is a badminton player who died because of heart attack at the age of 38. I mean, he was absolutely fit. He was into sports also, good nutrition, athlete, but he still had a heart attack. So this tells us that there are some other factors which are not clearly visible, but they are affecting the overall health of the human beings. And in my opinion, that is stress. So the more stress you have, the more chances of having such problems like erectile dysfunction or impotency or heart attacks or all these things. There is also a study which says that when it comes to heart attack and ED, how are both linked? Uh, if you have ED, which is vascular ED, which means because of the less blood supply into the penis, then in the period of about 3 to 5 years, there are chances that you will get a heart attack or a stroke. Okay, so ED is a risk factor for stroke or heart disease. Now, um, of course, lack of exercise, sedentary lifestyle means sitting at one place for a long time, not moving around, eating junk food and food from outside, which has increased due to Swiggy, Zomato, and all these apps have come in. So um, they people have become much more lazier. They don't want to go out. They just want to uh, sit with their phones and order something. So this kind of lifestyle will lead to decrease in your not only your sexual health but also your overall health and especially mental health. And mental health is strongly linked to sexual health. So if mental health goes down, the sexual health will also go down. So find out ways of relieving stress, take a break, meditation, exercise, do something which helps you, which makes you feel good, because that is also a kind of meditation and a stress buster. If you feel like doing swimming, you can go for swim. If you feel like if you are into painting or art, you can do that. Whatever makes you forget everything and give that happiness, do that. So this is one thing to prevent. Then yoga is very effective. There are 12 or 13 scientifically, clinically proven poses of yoga which have shown definite improvement in sexual health of men. Then I would say for specifically for sexual health, pelvic floor exercise is also a must, because those are the muscles which we do not exercise routinely. So once you have an understanding of those muscles, start exercising those muscles as well. And proper sex education is more important, especially for young generation, to practice safe sex. So use of condoms is definitely the most important thing, because there is a tremendous increase in the prevalence of sexually transmitted diseases in the last decade or so. So use of condoms is very important for younger generations as well as for the other men as well. So these are few things which they should keep in mind, like relieving stress, do some activity which helps you relieve stress or which helps you forget everything, exercise, healthy diet, lot of vegetables, fruits, especially Mediterranean diet. Mediterranean diet is supposed to be very, very beneficial for heart and as well as for erections and your sexual health. Mediterranean diet includes a lot of nuts and green leafy vegetables, legumes, pulses, fishes, oil, eggs. So all these come into the Mediterranean diet, and do moderate amount of cardio, like 20-30 minutes of running every day would be fine. Yoga, pelvic floor exercises. So these are the few things for improving sexual health in younger, or preventing sexual problems in younger generation.
Thank you so much for pointing and explicitly elaborating all those, sir. So, are there any types of erectile dysfunction or any types of impotency that people should know about? Different types?
Yes, generally speaking, there are three types of impotency. One is psychogenic, the other is organic, and the third is mixed. Psychogenic means the erections are not happening because of some issue with the brain. Mostly in young men, it's psychogenic erectile dysfunction. So, psychogenic ED is very common below the age of 30. After the age of 30, psychogenic is common, but then there is another component also which is called as vasculogenic. So they have something called as mixed. Vasculogenic means that there is a physical blockage in the blood supply, or the penis is not able to hold the blood inside it. So that is a physical problem is there. That is vasculogenic or organic. And the third is mixed, which means the patient has both psychological element as well as a physical blockage somewhere. So these are the three types of erectile dysfunction: psychogenic, organic, and mixed.
So, are there also anything such as situational erectile dysfunction? Is it a type?
Yeah, there is a term which we use for certain situations, like the person is able to have a good erection in masturbation, but he's not able to have a good erection in during the intercourse, or he is able to have a good erection with one particular person and he's not able to have erection with other person, or he's not able to have he's able to have a erection in a specific situation, like or in a specific position, but he loses erection in when he goes into a different position or goes in a different setting. So these are examples of situational erectile dysfunction. So it depends on the situation.
Okay, thank you so much, sir. Also wanted to know if these types of erectile dysfunctions that you've mentioned are reversible. So are they completely reversible or curable, or are there some types that are not reversible at all?
Yes, so this is very important question, and nobody tells these the right answer, the correct answer to these questions. First of all, erectile dysfunction, the whether it is reversible or irreversible depends on the type of erectile dysfunction. So psychogenic erectile dysfunction mostly is reversible, with psychotherapy, antidepressants or anti-anxiety, psychological treatment with some other medications, it's reversible. Organic ED, on the other hand, which means that there is a physical blockage or the functioning of the valves has reduced because of the age or because of the diabetes or because of cholesterol or because of high blood pressure or because of hormones. So these uh, can be reversed to some extent, but cannot be completely reversed. Okay, so there is no cure for that for this particular type of erectile dysfunction, but there is a management or treatment. Patients can live a happy sexual life with treatment. Okay, so depends on the type or the depends on the cause of erectile dysfunction. We can reverse it or it is irreversible. It depends absolutely on the cause and the type.
So, sir, in your practice, in your everyday practice, what are the most common risk factors for erectile dysfunction that you have observed that people come up with?
Mostly, as I said, sedentary lifestyle, lot of stress, cigarettes, these days marijuana, too much of alcohol, lack of sleep, diabetes, hypertension, obesity, testosterone deficiency. These are the few common problems which can lead to erectile dysfunction.
Um, so how important is it for both men and women to highlight their sexual health concerns with each other and with a practitioner? Because as you are aware, this topic is such a big taboo in India, and sexuality for women and men, talking about that for both is a very big taboo still at this day and age. So can you please highlight this aspect so that our audience can also have the encouragement to come up if they are facing any issues?
In my everyday practice, in my last 8 years of experience with sexual health disease patients, I would say that it is very, very, very important to talk about your sexual health with your partner. First with your partner and then with your practitioner. I have seen a lot of couples not living happily together, ending up finally in divorce just because they were not happy sexually. So many couples I've seen, and these days the prevalence is increasing because the tolerance power of the young generation is not as much as it was earlier, and plus they are more aware about these problems and that the treatments exist for these problems. Most of the men are shy because obviously it affects their ego, that why they have the problem and why is his friend which is normal. So it's not in your hands. So see, it's with any disease like diabetes or like blood pressure. It just happened to you. You can't compare it with that, why your friend doesn't have diabetes and why I have diabetes. It just happens because of the mostly because of the lifestyles. So if it happens to you, there are scientific and safe and effective treatments available for the treatment of such problems. Okay, so I would encourage and I would motivate everybody who listens to this talk that please talk to your partner about your sexual problem. That will ease some pressure off your mind, and it might, improve your sexual health to some extent, because obviously sex is linked to brain. If there is pressure, if there is anxiety, then there will be a problem with the erection. If the anxiety is not there, if the pressure is not there, if the patient is free or relaxed, then he can have better erections. So talk to your partner first. Do something special for her, or both of you do something together, discuss about this thing. And if this doesn't help, then talk to the practitioner, to somebody who is dealing with such issues, who is certified, qualified, and dealing with these kind of issues. So ask questions to your practitioner, whatever questions you want to ask, whatever doubts you have regarding sexual health. There are a lot of myths and misconceptions about sexual health, especially in India. So whenever patients come to me, they have a lot of questions in mind. So I would say that whoever you go to, ask a lot of questions. That will take some pressure off your mind, and you will notice that few of the things which you thought were abnormal are actually normal.
Thank you so much for highlighting that, sir. So, as the topic for today is latest advances in the treatment of impotency, we are also interested in knowing if there are any latest advances in the diagnosis for impotency or erectile dysfunction.
Well, diagnosis still remains the old-fashioned way, which is based on history and clinical examination and a few lab parameters. Nothing special or nothing very specific.
Okay, sir. So, is there any method to self-diagnose erectile dysfunction or impotency? Is there
Well,
something like that?
yes. If you are having, first you should know what is erectile dysfunction. So if you have been having problems with getting an erection, or you are losing erection while during the act again and again in the last for more than last 6 months, if you're having this kind of problems, then this means you have some problem down there. And if it happens most of the times, like once or twice in 10 times, is not a problem. But if it happens more than 5 times, 6 times, means half of the times, it is considered a problem. Then there is a tool also which you can download online. It's called International Index of Erectile Function. So there are a few questions, and you answer those questions, and in the end, you will get the score, and then check the score where you fall in which category.
Great. Thank you so
So
much, sir.
that is another, yeah.
That is another tool for finding out if you are facing erectile dysfunction issues via self-diagnosis method. So let us now move on to the critical aspect, which is the treatment of erectile dysfunction and impotency. So, sir, can you please highlight this? What are the available methods?
Yeah, so if you can just run my slides from the treatment part. No, just the treatment. Go further, more. Go ahead. Come to the treatment part. Go ahead, go ahead, go ahead. Yes. No, no, no. Back, 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 back. Back, 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 back. Yes. So the most important thing is to identify the risk factors, whether it is smoking or stress or sedentary lifestyle or weight. So most important thing is identify the risk factors, eliminate the risk factors, find out the cause, whether it is because of some surgery or because of some medication. Many antipsychotic or antidepressant medications can cause erectile dysfunction. So find out whether he's taking any medications, he's had any surgery, or he's had any chronic illness or like dengue or malaria or anything, because post that also patients can have problem with sexual health. Then does he have any hormone deficiency, symptoms of testosterone deficiency? So you have to identify the cause and identify the risk factor, eliminate the risk factor, treat the cause. That is the most important thing. Then exercise, cardio activity, meditation, it calms down your sympathetic system, that increases the blood flow to the penis, and that gives you better erection. Next. Yeah. So losing weight, cutting down on smoking, plenty of water, sleep for at least 7 to 8 hours, because it is in the sleep that the most of the testosterone is produced. So sleep is the most important thing. So these are the lifestyle changes which you can do. Next. Yoga, as I said, clinically, scientifically proven poses of improving sexual health. The video of those poses is on my YouTube channel. Then vegetables and fruits, then muscles, exercises of the pelvic floor muscles, and in some cases who have psychological issues, psychotherapy or cognitive behavioral therapy can also work. Next. Then there are supplements like L-arginine or ashwagandha, shilajit, or Mucuna perennis, Tribulus terrestris, horny goatweed, yohimbine. So all these are supplements which you can take, but after proper guidance from a doctor, because some of the supplements can cause adverse effects also. So take the supplements under the guidance of a doctor and take it for a longer time, because taking it for like 15 days, 1 month doesn't really make a big difference. You have to take it for at least 3 to 6 months. Next. Then there are prescription medications like sildenafil, tadalafil, uh, vardenafil, avanafil, udenafil. All these are the medications which we use for treatment of erectile dysfunction. You can take these medications daily, or depending on the type of erectile dysfunction you have and what your doctor has suggested, or you can take it on an SOS basis, which means just before sex. So there are a lot of medications, and your doctor would be able to tell you better which would be the best suited for you. Most of the medications are safe, but still it is advisable that you take opinion of your doctor before starting any of these medications. All right. Yeah. So now the newer treatments available this is one of the most researched and experienced treatment for erectile dysfunction, called a shockwave therapy from Germany. Usually 6 to 12 sessions, safe, painless, non-invasive. And how it works is basically it forms new blood vessels and increases the blood flow to the penis. So this is one thing which users should know, that there is a option, alternative option to heal the penis from inside. Next. Then this is electromagnetic therapy from South Korea, 10 to 15 sessions, safe, painless, and non-invasive, and it acts on a cellular level and increases the blood flow to the penis. This is also a very good option for many patients, especially young to middle-aged patients. This is a very good option. It also works on the strengthening the muscles of the pelvic floor. So pelvic floor muscles produce about the 20 to 30% of the erection. And a normal erection, 20 to 30% is because of the pelvic floor muscles. Then the other is the PRP, or the P short, very popular in the United States and Europe and in other Western countries. It's basically platelet-rich plasma. We take blood from you and centrifuge it, take out the platelets, and inject the platelets into the penis after numbing the penis. So these are the few latest treatments for the treatment of erectile dysfunction. I would say that the most important is identify the risk factor and treat the cause, and then supplements, medicines, and therapies.
Definitely, sir. Thank you so much for explaining that in such a great detail. A few last questions before we end this super informative discussion is what all still is required so that we can remove this taboo from Indian people around discussion of sexual health and sexual health topics. What, in your opinion,
Most
is
important,
required?
my opinion, the most important is sexual education and awareness. As you make people more aware about these problems, that these are problems, and then there are scientific treatments available for these problems, people will become convinced, and then they will start approaching the doctors. So most important is education starting from the school level up till the college. In few years back there was a movement, but then because of some issues the movement was stopped, and the topic of sexual education was also kind of disregarded. So I would say that politically also there must be some focus on sexual education in schools, and doctors themselves should come out and start educating people and public about sexual health diseases.
Thank you so much, sir. And what would be your one take-home message to all those who are watching this show?
My take home message for this show and for my audience would be that do not hesitate to talk about sexual health issues. Approach the doctor as soon as possible. You trust me, you will have a very, very happy life if your sexual health issues are scientifically and safely resolved. So talk out, go out and speak.
Thank you so much, sir. I would like to thank Dr. Chirag Bhandari for taking out his valuable time and sharing with us all the insights and information for the topic of latest advances and treatment of impotency. Sir, thank you so much for being on the show.
Thank you.
I would
Thank you
also
very
like
much, Ajmal. Thank you.
I would also like to thank JB Chemicals and Pharmaceuticals for partnering up with this on this awareness mission with IHW Council. Thank you so much. Lastly, I would like to thank all the viewers for staying with us till the very end. I hope you got valuable insights and information regarding this topic in the session. And if you did, please share this with your friends and family and those in need. Thank you so much. With that, we wrap the session up. Thank you.
Thank you.